Alright, so just getting started here with Spud. It's all set up. Alright. So Spud's a little quarter horse at Chelsea Miller Equine Therapy and Rehabilitation in Cave Creek, Arizona. Just getting ready to do a full body eval and adjustment on Spud here. He's a little quarter horse. If I can get this thing to stay upright. There we go. Alright, so let's see what we can find on him today. I have not worked on him. He's a new horse for me, so I'll be taking my time with him to see what we can get done. Seems real tight here. There's biceps tendon on his right side, so he seems pretty tight through here. See, he wants to back up. Light pressure being applied there. So you've got sensitivity there. Yeah, so definitely through there we've got a little bit of pain and discomfort, so I'll be taking a look at that. It's on both sides. So when they have that tenderness in the bicep tendon, which on us is right here, what that's telling me is that they're using their front legs to pull them instead of driving off the back end. So they're overusing the muscles in the shoulders to get their bodies moving forward. So you want to see them using more of their hind end to get moving, but when they have sore bicep tendons like that, that means that they're using their front end too much to pull instead of using their hind ends to drive themselves. So that's the first thing. Check his pelvis back here. So this guy had surgery in his hind end. He has a bunch of plates and screws in his pasture on his right hind. So I'm not going to do a whole lot with that right hind, but I'm going to check his pelvis. I'm going to adjust all, the three of his legs, and I will do some stuff with that right hind, but just I won't be adjusting that pasture. And he's just not too sure because this is his first time, so just take my time with him. A little uncomfortable flexing his pelvis back there. Sometimes they're just not too sure about the pelvic reflexes too because they haven't had them done before, and this is all new. So he's a little bit watchy, a little unsure about those. But I always back up what I'm finding with the pressure points with manual range of motion shifts. I'm just going to put a little flexion pressure for the SI joints and see if he's comfortable with that. Handles that just fine. Check the other side. Hope you guys are all having a great day. Thanks for coming in and joining the live. little adjustment back there on that left side. Looks a little stunned from that for a second. Boy. That's nice. I think I'm going to start doing more of my lives over here on YouTube, since TikTok has just not been really good to its creators recently. They just don't pay well. They're not pushing content anymore. You're not advertising on the TikTok shop. They don't show your stuff. So I'll be doing more and more of my lives over here on YouTube instead, and see how that goes. That's really good. When I'm applying pressure to that shoulder pressure point, I want them to turn their head to the direction where I'm pushing and then come down and touch my hand. So you can see he hesitated for a second there, but then came all the way around and touched, and we got a nice little release in the neck there. So I'm going to bring him around the other way and see if he can do it to his right shoulder, and then if we get any audible releases there, then we'll go both directions again. But I know I already have to come back to the left side at least to recheck that side, since we had a release in that mid neck there. Wow. So we had a couple of good ones there, so we're going to have to go back and forth and do both sides again. Yeah, on TikTok I have like 10 times the amount of followers I have on YouTube. I think I have around 80,000 on YouTube and 730,000 on TikTok. And you know, I get paid way better by YouTube with those 70,000 followers than I do with TikTok with 730,000. So it doesn't make much sense to waste my time over there anymore. So I'm going to be doing most of my stuff on here. Yeah, he's a super sweet guy. He doesn't quite know what's going on. This is his first one, but he's doing really, really good. So much easier that second time, and I'm going to check him to the other side one more time. So you can see both times I brought him around to his right, he wants to flee, right? He starts to come around, he comes and goes as far as he can, and then he wants to move away. So I'm going to dig in a little bit deeper on that left side and see if I can't find what's bothering him on this side. So he wants to break over. He breaks over just fine at the pole. When you get him to about 90 degrees of turn, then he wants to start fussing and pulling away. So I just adjusted him right at that C3, C4 level, which is about halfway down the neck. See if that helps him move a little bit better to that right side. Awesome, guys. Thank you so much. If you guys don't mind hitting that like button for me. I would greatly appreciate it. And please consider subscribing if you haven't done so already. It'd be great to have you in my channel. Like I said, I'll be going live a lot more here instead of over on TikTok, so hopefully you'll be seeing me a little bit more often on YouTube. Jumpy he is just by me touching him right here. I'll move him up a little bit so you can see that even more. Oh boy. So you'll see when I just touch him here, nice and lightly, see that spasm? It's pretty bad on that side, lower neck, biceps tendon area. And if I touch him over here, so he's really overworking these anterior deltoids, the bicep tendon, the biceps, and it's making that whole area really, really sore. I'm glad you like it, Misty. Thank you very much. So I'm just going to do a little bit of muscle work up here and try to get some of this pain to go away. So I'm just going to apply a real light pressure to this bicep tendon. See if I can't get a little bit of relaxation out of him, let it release, and see if this goes away a little bit. Doing really good with this considering how sensitive it was. Just stretching all of this out as much as I can. Just trying to get him some relief in all these front muscles from here all the way to here, as well as in the lower neck on that side. Just give him some relief, try to get some of that inflammation out of there, make it a little bit more comfortable. Cindy, I'm out of Arizona. Still got a little bit more up here. See how much better that is already. A little bit still in there, right there. A lot of areas to treat on him. Had a little adjustment on that lower left side. Yeah, he's a little sore, this guy. Awesome. Thank you guys for taking the time to be in my live, and for the likes. If you haven't hit that like button yet, greatly appreciate it if you would do so. Also, if you want to follow my channel, that would be awesome as well, as I'm going to start going live a lot more on this channel. And hopefully bring over some of my audience from TikTok. And if you have horses of your own and you want to learn how to do some stretches for them, you can go to my website, which is in the which is in the description of all my other videos. But that website is sporthorsechiropractic.com. And at the top of the page, you'll see a link to my Equine Stretching Masterclass. I just put together a video tutorial series where I just walk you through how to do a whole bunch of different stretches for all major areas of your horse's body. Spud seems to really love his leg stretches here. This is one of the stretches I teach on my website as well. It's a shoulder flexion stretch. The shoulder flexion and the extension all in the same movement. That's a good boy. That's really good. He's doing great. Yeah, Laura, yeah, he's being so good. And this is his first time also, so it's really amazing that he's standing so quietly. There we go. You see that a little bit better. So you can see that on this right side here, how tender he is. And you can also tell that he's not as comfortable bringing that shoulder out on the side. So we have a little correlation there. Hello, from Ireland. That's amazing. Thank you for watching. Stretch this out and then do a little of that muscle work for him on this side as well. See if we can't calm down some of those muscle spasms. Got a little startled by something there. That was really good. He's a good boy. Thank you. Yeah, he's a very, very good patient for sure. Just try to give him a good pull stretch here. Just help him relax a little bit. There we go. Really nice release there at his pull and flexion. There we go. See how his head's starting to go lower and lower and lower. That's my favorite response to see, even more so than the licking of the lips, is watching his head drop lower and lower and lower and lower. It's a really good sign of relaxation, good sign that they got to hit a dopamine, good sign that they're going out of that sympathetic fight or flight state into the parasympathetic rest and digest state. So something that I really love to see. So if he's kind of fussy like that, then I'm just going to let him go and reset. I'm going to get his hips adjusted, but it has to be done when he's relaxed and letting me, willing to let me do it. You can't force a horse to let you adjust his legs, right? Because he's obviously not going to do it if you force it. And if you try to force it, you're not going to get the adjustment done. So you got to be able to get that leg up. He's got to kind of drop it on you and relax so that you can get in there and then do the adjustment. KS, yeah, I see my equine clients about once every 2 months. So I tried to go out to 3 months. I don't think they hold that long the vast majority of the time. Some of them can, but I think it's the exception to the rule. Typically, I think 8 weeks is a really good time frame, especially if you can get to them right after the farrier does, so they can get their feet done and then you can get them adjusted. I think that's a really, really great thing for them. So yeah. They do hold for a lot longer than people, but I think about 8 weeks is usually the far end of that spectrum. A little sore on that hock on that side, so I will let the owner and trainer know about that. Let me get his TMJ adjusted. Stretch, come on. Go So I just want to see how his jaw moves. Check his teeth out. This is a really good TMJ stretch, which I highly recommend doing before and after you ride. I think it's excellent for their structure and for their neurology. Usually you'll see a really good release from them after you're done doing this. They'll keep licking their lips and shaking their head and doing a whole bunch of things, keeping their head low. So before you ride and whenever you take that bit out of their mouth is a really good time to stretch your horse's TMJs, which is another stretch I teach in my equine stretching course. Yeah, you bet. Okay, yes, no problem. Get his fly mask back on. Love it when they duck their heads down for me so I can put their fly mask on. Sign of a good horse right there. Agapito, you can go to sporthorsechiropractic.com. The link's going to be in this description on this live, but it's in all my other videos and my shorts on my YouTube channel as well. But if you just go to sporthorsechiropractic.com, click the link at the top of the page that says Equine Stretching Masterclass or Stretching Masterclass, and it'll walk you through the rest of the way. All the information on the course, including how much it costs, is going to be on that page as well. Got Mr. Sampson to do here next. It's a big boy. It's Sampson right here. He's a big gray gelding. He's eating, so why don't we go down here and see if our other horse is ready or if he's still eating as well. This is Miller Equine Rehabilitation in Cave Creek, Arizona. Yeah, so LJ's here, so we can go ahead and work on him, since he doesn't seem to be too interested in his food right now. I'm gonna go down here and get the swamp cooler. Makes working in this heat quite a bit more bearable. Go down here. He is poking his head out. Get started on him in a second. Just give me 1 second, guys. There we go. Got the fan going there. Oops. Go. All right. So I'm going to do my notes for Spud. If you guys have any comments or questions, please feel free to type them in there while I'm doing this. I'd be happy to answer any questions and have a little conversation while I'm doing this. Let's see. So this is the report I give all my clients. So I always put in here what I adjusted, and then I'll write some notes on this. So my clients get a PDF emailed to them with all of this information on it. Tells them exactly what I did and what my concerns are, if I have any referrals for them or any recommendations. It's all going to be on here. Buddy. So I'm going to put that humerus cranial on both sides because we had some soreness there. Nothing in the hind end except for the hesitancy to give me his left hind leg. Go back here and put in my notes for what I found on him. Sore in his lower neck on both sides. Whew. Lower neck we put bilaterally because that means on both sides. Worse on the right than the left. Also willing to have his right hind adjusted. Pulls the leg away, which is always fun to deal with on a 1,100-pound animal. All right, that's good. So we'll go back to the owner, and then we're going to add a new patient. So this guy's name is LJ. Equine, quarter horse. He's a little baby. It looks like a little bay. Gelding, new appointment. So this is a software called iTouch. Keeps really great records. Just something that I can send to my clients when I'm done with their horses so they can see what was going on. And then the great thing too is they can send it off to their vet if they have, if they take their horse to the vet and the vet wants to know what's going on. A lot of the times, the owners can't remember everything I've said to them about their horse, so they can go ahead and just email that, and I can email it directly to the vet as well, and they can get all my notes, which is great. This guy's going to be nice and fun to work on too, look. All right. Thank you, Diablo. Glad you enjoy them. We're going to get started on another one right now. Yeah, they added him, so there's 4.
I'll be here for a while.
Yeah.
Bye.
See you later. Thanks for your help. Right. Good boy. Having a little moment here before we start getting him adjusted. All right, so this is LJ, little quarter horse. There we go. So he's another new patient for me. So we'll see how he does. Just kind of take our time with him again and see what we find. So right off the bat, LJ looks like he's a little back sore. And it's on both sides. But no soreness right over the top of his spinous processes, so that's a good thing. Really nice lateral flexion in the pelvis. So that's just a little motion palpation we like to call the hula. So the hula just gets him kind of wiggling his hips like he's salsa dancing, you know, so we're just doing this. And we're applying pressure, pulling towards us with the root of the tail, and then applying a little bit of pressure in the opposite direction with the heel of our hand along the lateral border of the spinous processes. I go into a lot more depth on that in my equine stretching course as well. So if you want to learn how to do that, or any of these stretches that you're seeing me do, take a look at my equine stretching masterclass. You can find the link in the descriptions in all my videos. It'll be in the description for this live as well. And I think you'll find a lot of useful information there on how to keep your horse feeling good and performing well without having to call a body worker, massage therapist. And it's all really, really great information. So he does those pelvic flexion and reflexes really, really well. Let me tighten this up a little bit. I think if you learn how to do the pelvic flexion and reflexes as well as the leg stretches, those two things alone will make a huge difference in the comfort and performance of your horses. Highly recommend doing those. Feels really good in pelvic extension on this side. Really comfortable through his pelvis. Let's bring him around and touch here. multiple releases in his neck going to the right. That's beautiful. So what I'm going to do, since I got some audible releases there, is I'm going to have him go around to the other side and touch, and then have him come back around to this side and see if we get any more releases. And if we do, we're just going to keep going back and forth until we don't get any more of those. Good. So really nice movement to the left. No audible releases there, so I'm going to recheck him back around to the right. Awesome. So really good range of motion there. Didn't hear any pops, no audible releases, so we're good to move on to the next thing. And you can see him licking and chewing. That stuff feels really, really good for them, especially when you get those audible releases or those pops. Lights up the mechanoreceptors in the joint capsule. Those send a bunch of positional information to the brain. The brain loves positional information. It acts like it's a little shot of dopamine. They start licking their lips, licking and chewing, that type of stuff. It's really, really good for the nervous system. So those pressure points are amazing. Really good extension. So that's really, really common. When you have a horse that's really easy in extension, they tend to be a little bit tighter the opposite direction in flexion, which was the case for him. So I just did a little flexion adjustment for him there because he was a little bit restricted going in that direction. Awesome. And this guy has kind of a crooked underbite. See here? See how his teeth are off center here? So his lower jaw is stuck to this side. And I can show you this too. Up under his neck, his throat latch, he's got this big scar. You can see that, right? Going all the way from one side of his neck to the other. And it looks like at some point somebody tied a rope around his throat latch or something like that. And he got a big rope burn there. And all up in that area you have their hyoid, and the hyoid has a ton of muscles attached to it. All the muscles that move the tongue attached to that. It's got a muscle called the omohyoid. Omo means shoulder. They've got a muscle that attaches at the back of the hyoid and goes all the way down and attaches to the shoulder. It has a lot to do with chewing, movement of the jaw, and it affects the movement of the shoulder. So if you see a big scar like that in this area, you can expect to have some scar tissue on the inside of that that's going to be affecting that hyoid. So it's a good idea to check that, see if they're sore. You can do a bunch of muscle work on there. You can massage it, you can pulse it, and try to help relax some of those muscles up there and see if that changes the position of the jaw, or if they're head shakers or cribbers or something like that, or grinders. You can do some work on that hyoid to see if you can help with that as well. You can see with most of the horses that I work on, they really, really enjoy their leg stretches. I mean, you can see his head's down, his eyes are kind of closing, just relaxing into this. They really love their legs to be worked on. So if you want to help your horses relax, give them some relaxation like this, build a better bond with your horses, you can learn how to do these leg stretches, and it works really, really well. Get all that crusty chestnut off of there at the same time. Nice releasing that front belt lock there. Yeah, absolutely. Those Arabians are so flexible. They're skinny legs and big feet. Just stretching your horses is just a great way to build some rapport, build some trust with your horses. Almost out of water. It's been a busy day. Such a cool horse. Trying to get his back legs done so you can see it. It's just moving around a bunch. Oh, damn. Nice, releasing that stifle there. Whew. Oh, thanks, Sky Wizard. Appreciate that. Just had a really nice release in his stifle. It's pretty cool to be able to give these guys some relief, especially after all they do for their owners and riders. Surprised him a little bit on that one. Boy, but that was a really nice release in that hip. So we had stifle on the left, hip on the right. Boy, really nice release in that pull and flexion. Some people will say, oh, you know, there's no licking and chewing. What did that do? It didn't help. He's not licking and chewing. Look at his ears. Well, you can see his face and his body language. Like he's nice and relaxed, really enjoying this. Oh, awesome. Yeah, so I usually do most of my lives over on TikTok, but I'm going to start switching that up and doing them over here on YouTube. Just because YouTube treats their creators so much better than everybody else. Facebook does a good job as well, but you know, I've got 730,000 followers on TikTok, and you know, YouTube just treats me a lot better than they do, and I've got about 80,000 followers on YouTube. So I'll be coming back here a lot more often, so I hope you guys keep your eyes out for me going live here on YouTube. The other thing was I had an older phone and it wasn't doing very well, so got a new phone, so now I'll be going live a lot more as well. It is draining, especially in the summers here in Phoenix. It can be a lot, but helps when you have nice horses like LJ here to work on. Makes it a lot easier. So I'm going to stretch this TMJ, work on his hyoid a little bit, just see if he's sore anywhere up here as a result of what's going on here. So that's a good stretch. I just want to see them go into extension, just work that lower jaw, try to stretch some of the muscles around the TMJ out. Really good stretch for both TMJs right there. Thank you, Judy. I didn't want one. I was trying to wait till the fall when the new phones come out, but you know, can't be paying $68 for a brand new iPhone, so I'm happy with it. Tender. He's a little tender up here on the right side of his hyoid, right up under here. You see him kind of tossing his head around. But I'm just applying some light pressure. Yeah, I was having a bunch of problems with my old phone overheating, and the battery life was terrible. This one's still at 3/4 of the battery, and I've been recording for a couple hours, so this is really great. And no overheating issues whatsoever. There you go. Nice and comfortable up in there now. So it just takes a little bit of pressure, a little bit of massage right up under here. So right up on the inside of the jowl, you're just kind of feeling for any tender spots there. And if you find them, you just kind of put a little bit of pressure up towards the ceiling and just kind of hold it for a minute. You can rub back and forth while you do that as well. Just give them some relief in those tongue muscles. And no, that's not a blindfold. That's a fly mask. Just keeps the flies out of their eyes and off their face. There we go. Oh, it's rubbing on me a little bit. Super, super sweet horse right there. Horses like him make my job really enjoyable. All right, so we're all done here. I'm all done here for today. So I am going to sign off, but thank you guys so much for sticking around and joining my live. If you don't mind tapping that like button for me before I end it, that would be really great. And LJ says thank you for watching his adjustment as well. Such a good boy right there. Awesome. Thank you for whoever just did that. Thank you so much. See a couple likes come in there. That's what it's all about, guys. The YouTube algorithm loves the likes and the shares and follows and subscribers and all that stuff. So thank you guys so much, and I hope to see you again on my next live. Have a wonderful day.